My shoulder pain is not letting me sleep. Do I need to undergo surgery or are there any non-surgical options also? Let's talk about it today. I'm Dr. Abhishek Bansal. Welcome to Healthcare today. So, shoulder pain is one of the very important causes because of which people visit shoulder surgeons, because which people go to orthopedic surgeons, nearby osteopaths, because they're not able to find relief. So, let's understand what are the treatment options for shoulder pain. The first and most important thing is to identify the cause of shoulder pain. Is the shoulder pain because of some local pathology or is it because of some systemic disease? I mean, am I suffering from diabetes? Do I have rheumatoid arthritis which is affecting my shoulder, or do I have some infective pathology which has damaged my shoulder? These are some of the causes. Apart from some tumors, something else which is affecting the shoulder, a degenerative rotator cuff tear or a dislocation which has led to labral tear. Maybe a gymming boy who has lifted heavy weight, he can damage his muscles. So first thing is to identify the cause. Once we have identified the cause, then we chalk out the strategy as to non-operative means and operative means. In all the patients, a trial of non-operative therapy is always given before advising for any surgery. So what are the steps to accomplish this? First step is precaution. Do no harm, no further harm to what has already been damaged, which means don't do an exercise or pull push which can affect an already injured muscle, or don't do an activity which can displace a fracture. Heavy weight lifting, if somebody sustained an injury while lifting heavy weight and he continues to do so with an injured muscle, is likely to cause further damage. Don't do that. The second step is, once you visit us, the second step is to undergo some kind of heat or cold therapy. So both of them work differently. In acute stages, when the injury is fresh, when there is inflammation, cold therapy usually works better. Whereas in chronic conditions, once the shoulder stiffness has set in, it will be a good idea to do hot fomentation so as to mobilize the shoulder a little bit. Some counter-irritant ointments are available over the counters, like where you can apply to get symptomatic relief. Second step is physiotherapy. Go to a trained physiotherapist who can help you mobilize your stiff shoulder, who can help you with the exercises which you are not supposed to do. There are some modalities of electrotherapy like ultrasonics and IFTs which can help reduce the inflammation and thereby improve the symptoms. Certain type of strengthening exercises can be started once the shoulder starts to improve, so that the muscle training can lead to prevention of further injury in the future. If you respond to all this, it's very good. And apart from that, one more thing, therapeutic measures. There are some over-the-counter medicines available which can help heal the tendons and the ligaments and the muscles which get injured. They can be easily prescribed by some of the trained orthopedic surgeons near you. You can go to them. If you have got your investigations, if you know what you are suffering from but you're not able to find a proper opinion, you can send your investigations on the given number and we can help you out in terms of opinion as to what is best for you. One common mistake people do is neglect their shoulder pain for months and months while popping in pills for pain killing. Believe me, it's not a good idea. Painkillers can be dangerous if taken unsupervised and for prolonged periods of time. We will talk about it maybe in the next part as to what is the correct method of taking a painkiller if at all needed and for how long. We care about you.